All right, good evening. This is the recorded presentation portion for the assessment critique written, and I will be going over the sport competition anxiety test, also known as the SCAT, from Martins et al. 1990. So, for the ease of administration, I talked about how, it determines the client's and athlete's level of anxiety. It analyzes their responses to like multiple series of statements regarding their feelings and emotions during the game, the practice, competition, competitive setting, competitive atmosphere, and competitive environment. This test only requires a questionnaire. You can administer it by yourself or if you have an assistant. The coach practitioner can explain how to conduct it to the athlete client, and the athlete client can answer it by selecting and clicking either on rarely, sometimes, or often, any of those three, regarding their feelings when they're competing in their sport or in a competitive setting. No equipment is necessary, and it's not needed to conduct this assessment. It's simple. It's easy to set up, easy to conduct, and easy to administer. And an athlete, client, or even the team can take the assessment at the same time, anytime, any space, any session, and it can be conducted in like any court, field, pitch, gym, etc. And the athlete responds to 15 questions on the questionnaire, and there's no time limit. And then the practitioner, the coach, or the assistant can determine and record the athlete client's SCAT score. And like, for example, like some questions are like competing against others is socially enjoyable. And then they would select like rarely, sometimes, or often. That's an example question. There are no cultural biases. And the test is suitable for anyone. But medically, it's not suitable for individuals where they would be contraindicated. For medical issues, it would be inappropriate. For reliability, validity, the test is consistent and stable in measuring its intended measure, showing clarity, competence, and previous foundations of research and understanding. It is referred to as reliability, and depends on how strict the test is, and the client athlete's motivation levels on performing the test will show its reliability. And there's multiple factors that have an impact on the results of a test and test reliability. The degree to which the test measures and the claims to the extent to which inferences, conclusions, and decisions are based upon the test scores and which are meaningful and appropriate, in which case it refers to the validity. As far as scoring, the assessment can be analyzed and obtained by selecting your feelings, then after the test, clicking on the Analyze button, and then it determines and it shows based on the client athlete's input and answers regarding their feelings during competition. The scoring can be reset anytime. And that's pretty much it. I like it for its simplicity and its flexibility. Thank you.